Today we're talking to Dr. Stephen Spaulding about juvenile arthritis. Were you aware that that even existed? Doctor, I'm so glad that we're touching on this subject today. Thank you.
Thank you for letting us have the chance to talk about this important subject.
So it's scary. I mean, as a mom, I wouldn't even think that that exists. What is it?
So juvenile arthritis is actually a pretty common autoimmune disease that affects kids. And what happens in juvenile arthritis is that the joint tissue, the thing that connects our bones and allows us to move, that joint tissue gets attacked by the immune system and then causes pain and inflammation and swelling and makes it hard for that child to move whatever joint or joints are being affected.
Do we know what the causes are? Are some children more prone to it than others, certain age ranges maybe?
Sure. So, it's a pretty common condition. It affects about 300,000 kids. With all those kids, we don't know what causes it yet. And this is something we've been looking at for 20 years now.
Wow.
We know it's a problem with the immune system. The immune system is supposed to protect us from germs and viruses and things trying to get into our body, right? And in juvenile arthritis, what happens is that immune system gets directed to the joint tissue and it starts to attack the joint tissue. We don't know what triggers the immune system to see the joint tissue as being like a germ or a virus and trying to clear that. So a lot of research going on in that space because it's a common autoimmune condition like other autoimmune conditions of type 1 diabetes or thyroid disease.
Yeah.
And we do see some variation in age as well.
Okay. So you don't know really what causes it, but
Yep.
you obviously look for things when diagnosing it, I'm
Absolutely.
assuming. Okay,
Yep.
so what are those?
So one of the reasons why I treat kids is because when kids have arthritis, you know what they don't do? They don't complain about pain. They
don't, you're right. They don't complain about anything.
They don't complain about pain. They just keep doing the things that they want to do, but they do them in a different way.
Yeah.
So, if they're really avid soccer players, they'll keep playing soccer, but the parents will notice they're not as fast or they don't kick the ball as hard. When they wake up in the morning, they have a hard time moving around for 30, 60, 90 minutes.
Okay.
A joint will be swollen, it'll look puffy, and it'll, there won't be any injury, and the family will go to see their primary care doctor, they'll go to see an orthopedist, and maybe they get a cast, but that puffiness, that swelling doesn't go away.
Okay.
So those are the things that the family see, and they tell me when they come in and see us.
Oh, thank you for all that you're doing.
Sure.
And you brought up sports. I have to ask because I have a daughter that plays
Yep.
sports. Could that be a cause of some of these cases?
Not for juvenile arthritis. And
Okay.
in fact, we know the kids that do the best with juvenile arthritis are the ones that stay most active.
Is that right?
Absolutely. So, doing this for 13, 14 years now, I've had kids who have gone on to play piano at the Cleveland Institute of Music. I've had kids go on to play Division I football.
Good.
So,
Success.
Absolutely. We want those kids to be happy, healthy, normal kids.
Yes, for sure. Once diagnosed, what do you do to treat?
So we have lots of different medications available now that we can use to treat arthritis in kids, and all those things are aimed at the immune system. We said the immune system is the problem. It's overly active against the wrong target. We dial it back. We dial the immune system back. But it's not just about the medications. We have to treat the whole child, right? So we have to think about things like school and, and stress related to their illness. Sometimes they need a counselor. Sometimes they need some coping mechanisms.
Sure.
Sometimes they need physical therapy. Sometimes we work on diet. Diet's a huge piece of this. There are some families who say, boy, my child who has arthritis, if I take gluten out of their diet, their joint pain gets a little bit better. It doesn't go away completely, but it gets better. Some families say cow's milk. Some families say dairy products.
Okay.
So we really think about the entire child. It's not just take the medicine for the arthritis.
All right, so bottom line is if you're noticing certain little red flags,
Yep.
like it's taking them a little longer to get out of bed or some of
Exactly.
the other things you mentioned,
Yep.
go see your doctor
Absolutely.
at Akron Children's Hospital.
Absolutely.
So good to talk to you today. Thank you.
Thank you, Holly.